felt that bringing this research to a very well-respected global meeting would be the best way to get the information out to like-minded people across the globe in the interventional community.
Osteoporosis and the compression fractures are very common, and how to best treat these patients is still debated. With this trial we hoped to bring some new evidence and to help in decision making. In particular, in this session I will present the occurrence of new vertebral fractures and height loss. And we noticed that there is much more height loss in the patients treated with a sham procedure.
So the aim of the study was to look to see if GAE can reduce pain in these patients and reduce their reliance on medications such as NSAIDs and narcotics, as well as knee injections. So in 6 months' time, and there's been an average of a 60% reduction in the visual analog scale scores for these patients, and there's been over a 50% reduction in global WOMAC scores for these patients at 6 months. In addition, 65% of our patients had a decrease in their medication use for treatment of osteoarthritis at 6 months.
The evidence of PAE in the treatment of LAD secondary to BPH is not enough. And PAE is still considered like experimental. So what we want is to provide more data to support the widespread of use of PAE. We had good results in terms of clinical outcomes with improvement of IPSS, which is the most important clinical outcomes, and also with statistically significant improvement of that.
So my advice for young researchers that are interested in research is to find a good mentor. It might take some time. Reach out to the mentors that have been there for you during fellowship, during residency, during medical school.
My personal experience was that research is not easy, sometimes can be frustrating, but it's very important to continue, even if inclusion of patients can go very slow.
I would like to encourage young colleagues to perform studies and clinical trials to provide clinical evidence in the field of interventional radiology, and also to promote in the long term the health of our patients.
Submit your abstract to CIRSE 2019.